Alright, so now we got the ice pack out. Now I'm going to put a pad on top of the, can you see me okay? Alright, I'm going to put a pad on the top of the ice pack. And then I'm going to take some Medi pads. These are witch hazel hemorrhoidal pads. This will help cool down and soothe everything because it can be quite painful down there. Especially when that anesthesia starts to wear off. You can just kind of make this like a sandwich. And then I'm going to take some ointment. This is going to help relieve some of the pain and itching that you may experience. And I'll just put a little bit of that across the hazel witch pads. Okay. And then the last thing here is dermoplast. This will help relieve pain. Do you want to have it sprayed down there, or do you want me to spray it on the pad? Spray it on the pad? Okay. So we'll just spray a little bit on there. Oh, that's strong. I'm gonna help you put on the pad here. So this will just, oh, that's moving. My brakes are not locked like they should be. Actually, and while I have your gown pulled up, are you okay if I just hurry and assess for any distension, for bladder distension or bowel sounds? Okay. All right, I'll cover you up. There we go. All right, so I'm going to go ahead and just kind of look, and it looks good. There's no distension that I'm seeing from the bladder. I'm just gonna take a listen to your bowel sounds. Excuse me, sorry, wow. That dermoplast really got to me, didn't it? Okay, bowel sounds sound good. And have you been able to pass any flatulence or if you've been able to defecate? Good. Any constipation or troubles going to the bathroom? Not yet? Okay, that's good. Any pain while urinating? A little bit? Okay. Well, that's normal, considering the fact that you just had a baby. Which also, this can also help too. This is just a warm peri-wash. And so instead of wiping, you just kind of spray some of this down there, and then this can help with the pain and itching. So you just kind of pat it dry. Just use that for the first few days. That'll help you. If you had a C-section, I would check your abdominal incision, make sure that's okay. So, which you didn't, but normally I would just check your abdominal incision and make sure it's good. I'd check your IV site and make sure there's no infiltration or anything of that nature. And then it's the correct flow rate and the right solution, which we've got, which is good. And then I would check your catheter, because since you can't get up in the meantime, for right now, we are looking at how much urine is in the catheter, any odor or discoloration. We're checking those things. I'm gonna come over here and I'm just gonna check your feet real quick. I'm gonna look for clonus. So I'm just gonna press up on your feet here. Let them go. That's good. They come back down nice and easily. I'm also gonna check for any kind of edema or swelling. Okay, that's good. Not too bad. Okay, any pain with that or tenderness when I touch you there? No. Okay. And we've got the SCDs on, so that's gonna help make sure there's no blood clots. While in the meantime, while you can't get up, that's gonna help. And then I'm gonna also check for any kind of drainage in the incision site. How are you doing with your baby? Are you having like any thoughts of harming your baby or yourself? No? Okay, that's good. I saw that you were interacting with your family pretty good, which is good. That's what we want. But if you had like if you have any kind of issues and are having any kind of postpartum depression, let us know, and then we can take care of your baby in the nursery for a little bit and let you get some help. And we can get a social worker. We have plenty of resources that can help you. Post-surgery, I told you could have the ice pack and stuff. That'll help with your pain. Also, you can deep breathe and cough. So you're gonna turn your head and then you're gonna cough. And that will help with the potential of not getting pneumonia, which we don't want. And then if you're having pain from the incision or anything, you can just have a pillow, and then you also want to try to deep breathe. And then there's plenty of resources that we have. If you have any questions, you can let us know and we can get you the help you need. But as far as I can see, I've done my assessment and I can allow your family to come back in. And then I'll chart everything that I saw and I'll give you your baby back, let you bond with it, and in the meantime, if you have any questions, let me know. I'm gonna get you back to lower your back to the ground. Okay. And then some reasons why, I forgot to say, some reasons why we would want to do a C-section is if there's fetal distress, or if there's lack of progress, or sometimes if your pelvis is not made in a way that the baby can descend, we would do a C-section. And then the Duramorph, we did give you Duramorph, which is a pain medication. I do have to check your respirations and come in periodically every 15-30 minutes and check and make sure that you're not having any kind of respiratory distress, and because it can cause respiratory depression, but we'll make sure you're doing okay. I'm gonna put a continuous pulse ox on you so we can monitor that and make sure everything's good there. And I think I covered everything. So it was nice to meet you, and here's your call light if you need it. And I'll talk to you soon.